Thank you for tuning in to another episode of Watson Clinic Health Talk. Flu season is right around the corner, and the most effective means of protecting yourself is by receiving the annual flu vaccine. Thankfully, Watson Clinic makes it easy. Every year, we set up individual flu clinics inside some of our most popular locations, and patients can just walk right in and get their vaccine without the need for an appointment. This year's flu clinic locations are scheduled to open on September 8th, and you can find those locations and operating hours at watsonclinic.com/flu or by calling 863-680-7-FLU. Of course, if you don't receive your vaccine at one of our flu clinics, you can also get it during a regularly scheduled appointment with your primary care specialist. Our guest on this episode is Dr. Lilliam Chiques, an internal medicine and obesity medicine specialist at our Watson Clinic main location in Lakeland. She's also the medical director of Watson Clinic. She's here to discuss the seasonal flu shot and 2 additional vaccinations: the pneumococcal vaccine, which protects against pneumonia, meningitis, and infections of the bloodstream, and the Shingles vaccine, that protects against the painful viral infection shingles. Information on the availability of both of these vaccines may also be found at watsonclinic.com/flu. Welcome back, Dr. Chiques. Thank you for being here. You were our very first guest last year. You started the whole ball rolling, so thank you for coming back.
Well, thank you for having me.
So today we're going to talk about something that you deal with very often in your internal medicine practice, and that's vaccinations. And we're going to cover 3 in particular: the vaccinations that prevent shingles, pneumonia, and the seasonal flu. Let's start with shingles. Tell me, what is shingles? How does it manifest itself? Who's at risk?
Shingles is a disease that you get from the varicella virus, chickenpox virus, that a lot of people have had when they were kids. We started vaccinating people after 1980 with a live virus vaccine, and since then the incidence of chickenpox has gone down. But in people who had chickenpox, or actually even people who have been vaccinated for chickenpox, because the chickenpox vaccine is a live virus vaccine, that particular strain can stay in your body. So if you had chickenpox or were vaccinated against chickenpox, the virus can live in your body. It usually lives in nerves in your body, and it's kind of sleeping, and it can be sleeping for your whole life and maybe never wake up. But sometimes when people have situations where their immune systems are lower, so say you have a medical condition, even diabetes can suppress your immune system, or you need to take medications for rheumatoid arthritis, which suppress your immune system, or you're just getting older. After the age of 50, our immune system starts to decline, even if we do everything right. Then the virus can wake up in your body, and then it wakes up in that nerve where it's living, and it will produce lesions that can be very painful. Similar to the chickenpox lesions, but because they are in the nerve, they can be extremely excruciatingly painful. You can get a fever and feel really bad overall. And then if you get that reactivation in one of the nerves of your face, it can affect your eye, and that is an emergency. You need to be hospitalized for that so that it can be treated, because you can lose your eyesight if it happens in your face close to your eye.
Wow. So I had the chickenpox as a child. So that strain is still, you say it's sleeping within me? That sounds a little terrifying.
Yes. Yeah, it's just sleeping. It's there. It's living in your body.
Okay. And so when shingles arises, it's an inflammation of the nerve, or?
It's the actual infection
Okay.
That is activated in that nerve, and it will cause inflammation, and that inflammation will cause a lot of pain. And another scary thing about this reactivation of the virus is that even after you get cured from the shingles, that nerve can be damaged in such a way that you can continue to feel pain for years after you have that original infection. So, and that can be quite debilitating.
Okay. So what does the shingles vaccine do for you exactly?
So the shingle vaccine introduces a protein that is in the chickenpox virus, and it's a protein that when you put it inside your body, your immune system can train itself to fight the virus again. And what it does, it will help your immune system, even if it's a little suppressed, it will help it target the virus so that the virus doesn't have a chance to wake up.
Okay. Okay. And who is it recommended for, the shingles vaccine?
Anybody over the age of 50 should get it. And then people over the age of 18 who have illnesses that or medical conditions or are taking medications that suppress their immune system.
Okay. And how often is it administered?
The one that we have now, you get it twice. You get, if you got one now, then the next one would be between 2 and 6 months from now. And then you're all set. That's
so
it.
It's a 2-dose vaccination.
That's right.
And after 50, how often should you get that 2-dose vaccination?
Just once.
It's just once?
Just one time.
And I have some information here. Shingles affects roughly 1 in 3 people
That's right.
in the United States during their lifetime. So this isn't a rare occurrence.
That's right. It's very common.
Yeah. What are the most kind of severe potential complications from shingles?
Blindness. You can lose your eyesight if it happens in the nerve that goes to your eye, and then chronic pain, I would say. And then if you are extremely immunosuppressed, then you can have a disseminated infection and you could potentially die from that. But usually it's more about the pain and about the potential for vision loss. Shingles is a disease that sometimes can have strange presentations, and it can be a little fun for doctors because it's like you are to try to figure it out. Some people sometimes will come with chest pain, and you're thinking heart because especially if they're older people, you're thinking maybe there's something wrong with their heart or maybe something with their lungs, and sometimes that rash that makes a diagnosis doesn't come first. It can take a few days. You can have the pain first, and then the rash comes in. So it can be a little confusing. But then when you see the rash, then you feel like a hero because you know what it is and you know what to do, and you can easily bring comfort and resolution for the patient. So that can be rewarding in that sense when you see that rash, and then you can fix it.
Well, the vaccine. Yeah. You say it suppresses the presence of that virus in your body, and so that's a good preventative measure. If you have it, what kind of treatment protocols are available for it? If you're
able to get to your doctor and your doctor is able to diagnose you within the first 72 hours, there's antiviral medications that you can take that will shorten the duration of the disease. And there's also then pain medications that you can take because it can be very, very painful.
Yeah. Let's move on to pneumonia, and this is what's called the pneumococcal vaccine.
That's right.
Pneumonia is can be a very serious illness. What can you tell me about pneumonia? What brings it on?
It is caused by a bacteria, Streptococcus pneumonia, and there's many different strains or kinds of this bacteria, and they can cause infections from pneumonia to meningitis. They can cause abscesses. They can cause all sorts of different manifestations of the infection, and they can be lethal. Mm-hmm.
So the pneumococcal vaccine, obviously the intention of it is to prevent the occurrence of pneumonia. Who is eligible for that vaccine?
If you're an adult over the age of 18 and you have a condition that suppresses your immune system, are on medications that suppress your immune system, then you are eligible. We used to also vaccinate people who were over the age of 65, but the current recommendations are to consider it for people over the age of 50 because that's really when we start becoming more at risk for Streptococcus pneumonia bacteria. And it's not, like I said, it's not just pneumonia. It can even give you an infection in your brain, a meningitis. Yeah. So something you want to prevent.
Over the age of 50, it's recommended. Mm-hmm. Over the age of 18, if you're immunosuppressed. And then children, are there a particular set of factors for them? Or?
It's a routine vaccination for children.
Okay. Got it. And how often do you get it, the vaccine?
The vaccine, now we give just one. We come up with different just like with the COVID vaccine, we up with different vaccines to cover different strains over the years. And now the latest one is the PCV21, and it covers the strains that are more common in adults.
Is it annual like the flu vaccine?
It's a one-time dose.
Okay.
You get one and you're done. But now science continues to evolve, and maybe in 5 years they will come up with one that is even better, and then we will have a different conversation. But right now, the one that we have, the Prevnar 21, is one and done.
So it's not like the flu vaccine in that you get it annually?
No.
Okay.
It's just a one-time vaccine, so that's quick and easy. And that one, doctors at the Watson Clinic, we have it in our offices.
So you can administer it from the primary care offices?
That's right.
And we also have, every flu season, we operate a series of flu clinics at various locations. So patients can just walk right on in without an appointment, or they could schedule one, but and get their flu vaccination. And we also offer the Pneumovax during those clinics as well, don't we?
We do, yes.
Okay. And then you could also schedule an appointment with your primary, and they can give it to you as well. The flu seems so common that a lot of people might think it's a benign thing, but it's very serious. 47 million illnesses were recorded by the CDC last flu season, 610,000 hospitalizations, and kids are not immune to those complications as well. What would you like to say about the flu?
The flu is an illness that people can underestimate, because you can get the flu and it can just be a cold, and then you maybe need to rest for 1 or 2 days, and then you're okay. But even if you're a healthy person, you can be unlucky and have a strain in a given year that can make you seriously ill. The flu can kill children. So I always make sure when the flu season rolls around that my whole family gets immunized. My kids, my husband, my mother as well, because it can be particularly dangerous for older people. Mm-hmm. And it is something that you don't know which strain is going to be more harmful to you, and you never know when we're going to have a more virulent strain come around. There's talks about a bird flu strain that has been developing over this year that has jumped to different species, and that's worrisome, because that means that it's evolving, and that can at some point be not only able to infect humans but also get transmitted from human to human, and that could be something worse than actually the COVID pandemic. So it's something that scientists are watching. So it is a serious illness, even though it can sometimes be a trivial illness too. Mm-hmm.
So when is it considered flu season? What period of time in the year?
So usually the flu season starts in November. So we start immunizing people around late August, September, so that they have their immunity is up and they're ready for when the flu virus starts rolling around.
And so prior to that, they study what's going on out there, and they come up with that year's particular formula for that year's vaccine based on what's most likely.
The flu virus tends to be more common when it's cold in your area of the world. When it's cold, people tend to congregate together and not be so much in open spaces, and then the virus starts getting transmitted from person to person. So during the year, in the southern part of the world, you have it's winter there when it's summer here. So the scientists study what strains are becoming common in the southern hemisphere, mm-hmm. and from that they make an educated guess as to what we may see in our part of the world. And then the same thing when winter is here, they look at the strains that we actually got to predict what the people in the south are going to need.
In terms of hospitalizations and deaths mm-hmm. from the flu, are most of those are they respiratory related?
Yeah, usually they're respiratory related, yes.
Okay. So the flu clinics are seasonal. Towards the latter quarter of the year is when we open those, and that's when we definitely recommend everyone come in and get their annual flu shot from us. And they can also get it from primary care offices as well.
That's right.
I know one common concern is, and I've heard this particularly as it relates to the flu vaccine, where people will believe that the flu vaccine gave them the flu.
Yes, some people believe that, and that is not possible because there is one vaccine that is a live attenuated virus. So it's a live vaccine. So you could potentially get the flu from that one, but that's not the one that people normally get. Normally, you get a piece of the virus. You don't get something that can actually make you sick. But you can get side effects from getting the flu vaccine that resemble the flu infections. So some people can think that and then decide that vaccines are not for them, that they don't trust them.
And that's your body building its defenses against the real thing.
Yes.
Yeah. And so what's contained in the flu vaccine is an inactive strain? Or?
There are different kinds of vaccines. Some are just proteins from the virus. There's one that has the virus, but the virus is dead, so it cannot infect you. So there's different kinds. I recommend, I have this discussion with all of my patients every time, maybe opportunity that I have, that they should get vaccinated, and I go over the different vaccines that they're due for, because it depends on your age. You may not be due for all of these vaccines. But I do believe in vaccines, and I think we should get our vaccines and stay healthy. And a lot of times it's not just about us, but it's also about caring about our community and I think, love our neighbors is something that should be important to all of us. And I do love my neighbors, and I don't want them to get sick. So I do believe it's about caring for yourself, but also about caring for your community when you get a vaccine.
That's well said. Thank you for sharing that sentiment with us, and thank you for coming in. This has been a pleasure. Our first returning champion. Thank you.
Thank you for having me.
That's it for this episode of Watson Clinic Health Talk. Remember, for a detailed list of our flu clinic locations, operating hours, and more information related to the vaccines we've discussed on this program, visit watsonclinic.com/flu. or call 863-680-7-FLU. And appointments with Dr. Chiques may be scheduled by calling 863-680-7190 or by visiting watsonclinic.com/Chiques. That's CHIQUES.